Hi, welcome to the screencast for Topic 1, Part 1. In this screencast, we'll be going over the introduction to pathophysiology, and then we'll talk about cellular responses to stress and injury. We always start the screencasts, each section, with a learning objective of the things that you're supposed to learn throughout this section. The first learning objective is just to define some terms that you can see there. So you want to make sure that you know the definition to all of those terms. And we're going to go through some of these now. So pathophysiology is the study of the physiological changes in the body that result from disease processes. As you can imagine, it requires a good knowledge of anatomy and physiology. So you will be expected to know, or to at least review, if you have forgotten a lot, from your Bio 201 and 202 courses. I always will give you some review material from some of the previous chapters for you to look at, or if you just need further knowledge, you should either consult your old textbook or the review chapter for each section. Okay, so etiology is the cause of disease. We can describe etiologic factors. These are factors that are known to directly cause diseases, such as biological agents, including viruses and bacteria. Physical forces, such as trauma, burns, or chemical agents, and either nutritional excesses or nutritional deficits. Risk factors are factors that kind of predispose to disease or put you at risk for developing disease. They're not exactly necessarily causative, but they increase your likelihood. For instance, smoking is a risk factor for coronary artery disease. Idiopathic is a term that means the cause of the disease is unknown. And iatrogenic means a condition caused by medical treatment or procedure. Pathogenesis refers to the development or progression of the disease. This describes a sequence of cellular and tissue changes that occur following exposure to the etiologic agent. Ultimately, these changes, these cellular and tissue changes, are going to lead to the clinical manifestations of the disease. So clinical manifestations means the signs and symptoms. So these can be caused by the disease itself, or they could be due to the body's attempt to compensate for the disease. Signs are objective, and they can be observable or measurable to another person. For instance, a fever is a sign. A symptom is subjective. It's not observable or measurable to anyone but the patient. For instance, a headache or a stomach ache would be a symptom. A local manifestations means that it's limited to the area of injury. For instance, a sore throat would be a local symptom. Systemic manifestations would be a whole body manifestation, such as a fever would be a systemic sign. A syndrome refers to a set of signs and symptoms that are characteristic of disease and tend to occur together. So this would describe the manifestations, say, associated with Down syndrome. Acute disease is a sudden or short-term illness with marked signs. Marked, or the signs are really obvious, if you will. So the symptoms appear or worsen rapidly with acute disease. Some examples of acute diseases would be an infection, appendicitis, a heart attack, a stroke, asthma attack. With acute diseases, that acute period can resolve. It could resolve, and most do. It could end in death, or the patient could move on to a chronic form of the disease. Chronic disease is usually a milder condition, and it develops more slowly, but it persists a long time, and it can ultimately cause more permanent tissue damage. Some examples include osteoporosis or congestive heart failure, chronic obstructive pulmonary disease, or COPD. Chronic diseases may present with exacerbations, which means an increase in severity of the manifestations, and remissions, where we have a decrease or no symptoms. Okay, sequela and complications. A sequela is an unwanted outcome or abnormal condition as a result of disease, a treatment, or injury. For instance, paralysis following a stroke or scarring after a tissue injury. It's very similar to complications. Complications refers to a new or separate process that arise secondarily because of the change that's produced by the original problem. For instance, the development of gestational diabetes during pregnancy or of heart failure following a heart attack. Diagnosis refers to the identification of a disease by looking at the signs and the symptoms of the patient. Prognosis is the predicted outcome of the disease. Okay, at the end of each section I will have a concept check, and at each of these concept checks you should review the material and just make sure you understand. For instance, in this concept check you want to be able to take a disease such as, say, cystic fibrosis and see if you can define the following terms. Etiology. In the case of cystic fibrosis, that is a genetic disorder. Now, at this point you're not expected to know that cystic fibrosis is genetic, but rather what the term etiology means. Are there any risk factors? What does risk factor mean? What are the signs and symptoms? And you should be able to differentiate a sign from a symptom, not to mention a local versus a systemic manifestation. You should understand the term diagnosis and prognosis, and then be able to differentiate between iatrogenic and idiopathic. And then sometimes I'll have some test your knowledge questions. This one, the cause or origin of a disease or disorder as determined by medical diagnosis. Take a minute and try and determine the answer. Okay, and the answer is etiology. Okay, next test your knowledge question. John developed Cushing's syndrome as a result of excessive exogenous glucocorticoid use. In other words, he's taking steroids, maybe as a result of asthma. And secondarily, he developed Cushing's syndrome as a result of taking the steroids. So the cause, we would say the cause of his Cushing's syndrome is, so take a minute and determine the answer. And the answer is iatrogenic. So this is a condition caused by medical treatment. Okay, next concept check. Betty comes into the clinic complaining of body aches, chills, and a sore throat. You take her temperature and find it to be 101 degrees Fahrenheit. Upon examination of her throat, you find her tonsils to be enlarged, red, and edematous. The throat culture determines she has strep throat. Apply the following terms to her clinical manifestations: sign, symptom, local, and systemic. So let's go through each of these things. So complaining of body aches. So body ache isn't observable to another person other than the patient, so that would be a symptom. We would also describe that as systemic. That's a body-wide manifestation. So the body aches and chills would both fall together as a systemic symptom. A sore throat, that would be localized, but it's also a symptom, okay? Because we could see that it's red, but we can't see that it's sore, if you will. Okay, you take her temperature and you find her tonsils to be enlarged, red, and edematous. So enlarged tonsils that are red and edematous, those are all signs, because I can see them. And they would be local, because they're localized to the tonsils. A throat culture determines she has strep throat. Okay, so we did all that was asked there. Okay, next we're going to talk about cellular responses to stress and injury. Cellular adaptation. This is when cells adapt to a stressful environment in order to survive or maintain function. Cells do so by undergoing changes in their size, their number, or their type. When the stress is removed, the cell can return to its previous state. Atrophy refers to a decrease in the size of cells and tissue. Atrophy is caused by decreased work demand or adverse conditions, such as disuse atrophy. For instance, your arm is in a cast and you can't use it. Deinnervation, that would be a lack of a nerve supply to the muscle. A loss of endocrine stimulation, if it was an endocrine tissue that was endocrine responsive. Inadequate nutrients or nutrition. Ischemia or low oxygen levels to that tissue. All of these things can result in atrophy. And atrophy allows cells to conserve energy by reducing the size as well as the number of organelles. Hypertrophy is just the opposite. We see an increase in cell size and tissue mass. And this is a result of increased workload or increased hormonal stimulation. It can be a normal physiological response, such as we see with uterine smooth muscle with pregnancy, or skeletal muscle with pumping iron. Or it could also be a pathological adaptation. For instance, obstruction from the output of the urinary bladder, say by an enlarged prostate, can result in a hypertrophy of the smooth muscle of the bladder. We can also see hypertrophy of cardiac muscle as a result of systemic hypertension. Hyperplasia is an increase in the number of cells in an organ or tissue. So this can only occur in cells that are still capable of mitotic division. These are epithelial cells, smooth muscle, and connective tissues. We can also have a physiological or pathological hyperplasia as well. So physiological could be compensatory. For instance, we can receive part of someone's liver in a liver transplant and it can regenerate. That would be compensatory. And it does this through hyperplasia. Hormonal, for instance, increased number of milk-producing cells with pregnancy. The hormone prolactin stimulates proliferation of these milk cells. Or pathological could occur with excessive hormonal stimulation or growth factors. For instance, this can occur in the endometrium of the uterus, or this is the type of enlargement that we see in benign prostatic hyperplasia. Metaplasia is the reversible replacement of one mature cell type with another. Now this must occur within the same tissue class, for instance, within epithelial tissues. So we can't go between, say, muscle and epithelial. It has to be within the same tissue class. And this occurs in response to chronic irritation and inflammation. And what this does is it can allow for the substitution of cells that are better able to tolerate this environmental stress. The most common example is metaplasia that's seen in the lungs in the airways of smokers. So the ciliated epithelium that beats the mucus can't tolerate the chronic inflammation associated with smoking. And those get replaced with cuboidal epithelial cells that aren't ciliated. And this is in part what accounts for the smoker's cough. They don't have the cilia to beat the mucus towards the pharynx. If this stressor is not removed, this chronic irritation, inflammation is not removed, this can develop to dysplasia, which is the next one we're going to talk about, and ultimately neoplasia or cancer if that stimulus is not removed. So dysplasia refers to deranged cell growth that results from abnormal changes in both size, shape, and organization of the cells. So they're kind of, they're still the same cell type of the tissue of origin, but they beginning to not look so much like them anymore. Okay, and this dysplasia has been implicated as a precursor to cancer. One of the things they look for in a pap smear is dysplasia of the uterine cervix. However, even dysplasia is adaptive and thus is potentially reversible if the stimulus is removed. Okay, so let's go ahead and go through this concept check. For the following physiological or pathological conditions, describe what cellular adaptation is most likely to occur. A woman broke her left leg. 3 weeks later, you find her left leg is smaller than the right leg. The circumference of her right calf has increased by 2 centimeters, and she has new calluses on her right foot. So think about that one for a minute. B. The heart works hard to pump blood against a high systemic resistance. C. When part of the liver is removed, it can regenerate. D. The thymus decreases in size with age. E. In pregnancy, the uterus enlarges as a result of endocrine stimulation, and you should be able to name 2 types of adaptations that occur here. Okay, so pause the video and make sure you can answer all these before looking at the answer. And here's the answers. Okay, I'll leave that up. You can pause the video again and write down the answers. Check your answers, make sure they're correct. Okay, let's talk about injurious agents. Okay, so these are what kinds of things can damage cells. Hypoxia. This refers to a low oxygen concentration. Extremes of heat and cold. Electricity. Chemical agents such as drugs, lead, mercury. Biological agents. These include bacteria, viruses, fungus. Radiation. This could be ionizing UV radiation. Nutritional balances. This could be in terms of excess, obesity, or dietary deficiencies. Let's look at how stresses damage cells. They do this through direct damage to the proteins, to membranes, and to the DNA. There are 3 major mechanisms by which stresses damage cells: hypoxia or ischemia, free radical formation, and increased intracellular calcium. Just take a few minutes to look at this figure and see how these things lead to how these stresses ultimately damage cells. You can see the result ultimately leads to an increase influx of sodium and water and cellular swelling. With ATP depletion, we'll see cellular swelling. We'll also see an increase in anaerobic metabolism and decreased glycogen stores and intracellular pH. We can also see detachment of ribosomes, decreased protein synthesis, and lipid deposition. With free radical formation, we see oxidation of cellular structures and nuclear and mitochondrial DNA. And with too much intracellular calcium, so this can cause kind of this calcium cascade that leads to inappropriate activation of enzymes, and these can damage cellular organelles, the cytoskeleton, and cell membranes. It can also lead to increased ATP depletion and lead to fragmentation of the chromatin. Well, what are the outcomes of cellular injury? Cellular injury is potentially reversible, and the cells could recover and return to normal function. Cellular injury could also induce apoptosis and a programmed cell removal, or cellular injury can result in cell death and necrosis. So let's look at apoptosis. So apoptosis is a programmed cell death. This is where damaged or worn out cells kind of commit suicide, if you will. So they turn on their own enzymes inside the cell, and they digest their own proteins and DNA inside the cell. And then ultimately they get destroyed by phagocytic white blood cells. The key with apoptosis or programmed cell death is that the cell contents are not released. All the digestion occurs inside the cell, and therefore it does not result in inflammation. Necrosis is an unregulated cell death, and this is caused by injuries to cells. Cells swell and rupture in necrosis, and this leads to inflammation. Contents are often released, and inflammation results. There's different types of necrosis. Liquefactive. This is where some cells die, but their enzymes are not completely destroyed, and that leads to digestion of dead cells, and it creates this liquid mass, which gets walled off from healthy tissue. coagulative necrosis, we get acidosis, and this denatures the proteins and it causes them to kind of coagulate, looking like a boiled egg or boiled meat. It's characteristic of hypoxic injury seen in infarcted areas. For instance, in a myocardial infarction, we get coagulative necrosis. Casus necrosis, we have dead cells that persist indefinitely, and this can be seen in like tuberculosis. Gangrene occurs when a large mass of tissue undergoes necrosis. There's two main types. Dry gangrene, the tissues become dry and shrink. The tissues become black or dark brown. And this is usually the result of an inadequate or blocked arterial blood flow to the tissue. And this is a form of coagulative necrosis. Okay, gangrene is just a larger area. It spreads slow, and there's a line of demarcation. You can tell the difference between the healthy and the non-healthy tissue. Wet gangrene, this area is cold and swollen. It's moist, it's hence wet, black and pulseless, and has bacterial invasion. The spread is really fast here, and there's no line of demarcation. Death can result quickly due to spread if it's not stopped. This is usually due to interference with venous drainage, often seen in injuries, after surgeries potentially, in the feet of diabetic patients. Another type of gangrene not shown here is gas gangrene, and this is where we have bubbles of hydrogen sulfide, and this is due to infection of a particular bacterium. Okay, concept check. List and briefly describe the three main mechanisms of cellular injury. Okay, remember the three main mechanisms were hypoxia-induced cellular injury, free radical, and increased intracellular calcium. Ultimately, all three of them result in an increase in membrane permeability, cellular swelling, and if it becomes irreversible, necrosis. You should also be able to differentiate between cell death by apoptosis and cell death by necrosis. Oh, test your knowledge. How does hypoxia cause cell damage? Okay, once again, you should pause your video and try to answer the question. Okay, and it does this through diminished ATP production. So oxygen is a necessary component for most ATP production. So without enough oxygen, we have less ATP, and the cell can't function at the same level. If it is severe or prolonged, the cell will die. Okay, such as in myocardial infarction. The cardiac myocytes will die if deprived of oxygen for too long. Okay, that's it. We'll see you for topic 1, part B.